So today I will be explaining how to assist an adult who have obstructed airways and is unconscious. So it's important to notice that the adult is have obstructed airways because when he's unconscious, he may fall on the ground, so he has no proper upper position. So the tongue sometimes will slip to the back and obstruct the airways. So you're supposed to assist him in the situation. So the first step is to consider in the situation that you are. If you're in a hospital situation, you will be already with close equipment. So you may use gloves, you may use coats, and you may use proper equipment to prevent the touching of lips in the respiration. If you are outside the hospital, if you're in a real emergency situation, you will not have gloves, you will not have a gown, and you will not have the equipment from lip to lip. If you do not have the equipment for avoid contact between lip to lip and respiration, you may not do it because this puts your health in risk because you don't know if the patients have any contagious diseases. So when it comes to the procedure itself, the first step is to call emergency and ask for help. Then you should lay the patient on the back. Already my mom is already on the back, and you should position the head like this. And then you should start doing CPR. So I will not get into the procedure of CPR itself. So for CPR, you will put a hand upper and then a hand upper that in the middle of the chest. And then you will do 30 compressions. And then you will start doing respirations. If you're in the hospital, you may use this equipment to prevent not this equipment, it's just for you to understand what it is basically, but you will put between the mouth of the patient and yours before doing the two necessary respirations. When you open the patient's mouth, you should check if there's any object obstructing the airways, if the patient may be eating when he lost conscious, and if he had, please try not to put the object further into the airway. If this doesn't work, you should still keep doing the CPR till help gets here. So the procedure described before was described by the nursing assistant book. But with further researcher, I saw that you have different other types of things that you can do to disobstruct the airways of the patient. So after doing CPR and of course calling for help, one of the things that you may try to do if the patient does not wake up with the CPR or do not start breathing is you should lay the head back to extend the airway. That may help. If not, you should do like this, and after this, you should open the patient. One of the ideas is open the patient's mouth, do a hook with your two fingers and press on the submandibular part of the head. And with your upper finger, you should get into the patient's mouth and hold the tongue of the patient. You will hold the tongue of the patient, and then you'll press the head up. You will be carrying with your thumb the tongue of the patient, so the airway gets disobstructed.